So to respect everybody's time, I'm going to go ahead and get started. So welcome and thank you for attending the Iowa Intermediary Network live event, Counseling About Substance Education. Today, we're going to dive into careers in substance abuse counseling and the services that they provide. We're going to explore the day-to-day life of substance abuse counselors, and we're going to talk with two professionals that are going to give us an insight on the different types of counseling services that they provide, as well as information on the education and training required to be working in this field. Before we get started and introduce you to our professionals, I do have some housekeeping that I'd like to touch base on. You do have the opportunity, and we really hope that you will utilize it, to ask our panelists questions. Please type your questions into the Q&A at the bottom of your screen, and one of us will go ahead and ask your question. We really want this to be engaging and laid back, so please feel free. No question is a bad question. Now, to get started, let me introduce you to Lindsay Stack, who is a Special Projects Director and EMDR Certified Therapist at Pathways Behavioral Services, and Darcy Maiden Parks, Clinical Director from Substance Abuse Treatment Unit of Central Iowa. Good morning, ladies.
Good morning.
Good morning.
Oh, I guess I should say afternoon. My day has just flown by already. So good afternoon. Well, thank you so much for joining us today. I know that there are students that are out there that, they've heard of counseling. We're hoping to get away from that maybe stigma that comes with that term, especially right now. I know that there are a lot of people who are utilizing services with the way that the world has been lately. So if we don't mind, I'm just going to have Lindsay go ahead and give us a start as to who you are, what you do, and how you got into this field.
Okay, yeah, great. Like she said, my name is Lindsay Stack. I'm currently the Special Projects Director at Pathways Behavioral Services located in Waterloo, Iowa. I just celebrated my 10th anniversary with Pathways in August. So I've been here for a little while now, and I've done a lot of different things within the agency. So I'll kind of give you a summary of that, just so if you have questions about different areas of, I'll say addictions counseling, because I'll be talking about another addiction as well, just as far as my history in the field. I am also a licensed mental health counselor, so I actually do substance abuse treatment and mental health counseling. Which comes in really handy because most of the people that are suffering from substance use disorders have an underlying mental health condition that they're struggling with, and that's their way of coping with it. So that has been really helpful. I have a bachelor's and a master's degree from the University of Northern Iowa. I graduated from the clinical mental health counseling program there. And then went on my first initial stint in substance abuse treatment. I did an internship at Horizons, which is through Mercy One in Waterloo, and I was an inpatient substance abuse counselor. So people that stayed there 24 hours a day, 7 days a week for as long as they needed to. Usually it was a little bit shorter term. People usually stayed between 2 and 4 weeks there, but we worked really intensively with those folks. So that level of care is often reserved for people that have pretty significant substance use or addiction issues. Over the years, my first position at Pathways was as a gambling treatment counselor and prevention educator. So I did a lot of education out in the communities that we served. We covered an 8-county area at that time. That was a while ago. It's changed a little bit since then. So I got to go out and talk to students and other professionals and employers and just do a lot of different things with that. And then I also worked in that program for about 3.5 years. At that point, I moved over to our outpatient counseling program, where I started providing primarily substance abuse treatment with a little bit of mental health therapy. So at our agency, those programs are 2 separate things. And then from there, I moved into the position of being a treatment coordinator. So I supervised the majority of the outpatient counselors in our office and did that for the last 5 years until recently. We're making a lot of changes at Pathways. And so this position was kind of a brand new position that was created so that I could help make that transition. So that's what the special projects director is. It's a kind of a unique position. EMDR is a specific type of trauma therapy that I'm certified in. So I use that therapy often with clients, but not exclusively. Yeah, I don't know. Was there anything that I missed? I could ramble on forever, but I want to give Darcy some time.
Yeah, no, that's a great start. Thank you so much. Darcy, do you mind telling us a little bit about yourself?
So I'm Darcy Maiden Parks. I am the clinical director here at the Substance Abuse Treatment Unit of Central Iowa, or for short, SATUSI. We are a small outpatient treatment facility located in Marshalltown, Iowa. We have been in business for over 40 years, serving the Marshalltown community, as well as we also serve 4 surrounding counties. We serve Poweshiek, Tama, and Hardin County. And so our main office is in Marshalltown, and we have satellite offices in Hardin, Tama, and Poweshiek 1 day a week. I have been with SATUSI. I am in my 17th and a half year here. I began as an outpatient counselor, and 2 years ago took on the role as the clinical director. So I have seen a lot of different things as an outpatient counselor. I have done individual counseling, I've done group counseling, I've done some education, so just a variety of things. Sat on many of our committees that we have here within SATUSI. My education background is I have a bachelor's in social work from the University of Northern Iowa and a master's in clinical mental health counseling from Webster University in St. Louis, Missouri. So.
That's wonderful. Well, again, thank you both for being with us. I guess the first question I'd like to ask is, what is the role of a substance abuse counselor, and why is that an important role, and how does that differ from being a different kind of counselor?
Mm-hmm.
Do you want to take that one, Darcy?
Sure, I can take that one. Yeah. So the role of the substance abuse counselor is primarily we are working with individuals who are struggling with substance use disorders, whether that be alcohol, methamphetamine, marijuana, heroin, opioids. And so they are meeting with us. It's really not a whole lot different from any other type of counseling, because what you're working on those basic skills, coping skills, changing behaviors, learning to set boundaries, recognizing relapse triggers. So working with them on that. A session can be anywhere from a half an hour to an hour, depending on how often you want to meet with the client. You can meet with the client on a weekly basis for individual sessions, or bi-weekly, just kind of depending on what the client needs. We also then provide group counseling. And so in group counseling, then you're working along with some of those same types of things, changing behaviors, recognizing triggers, setting boundaries, helping them to be more independent and more accountable. A lot of times too, you're even just doing some case management type services. Many of our clients have burned a lot of bridges for whatever reason. So it may be connecting them. How do they get on food stamps? If they're coming out of prison, where can they go to get clothing? Where can they go to get other types of vouchers, maybe furniture vouchers, other types of supports, connecting them with other resources in the community. So it's really kind of a role that pretty much, at least my experience, almost changes on a daily basis, and changes kind of depending on what your client's needs are.
Yeah. And if I could add to that, I would just say, you asked what's so important about our role. And for a lot of our clients, we may be the only support that they have, the only person in their lives that understands what they're going through. They, like Darcy had said, some of them have burned bridges. Some family members or loved ones may have kind of written them off, so to speak, because addiction is something that affects their lives, and it's a ripple effect, and it happens often over many years for a lot of people. I mean, it can happen over a shorter amount of time as well. And so we become that person that they hopefully can trust and start to heal with. And then we work with them to help them repair those areas of their lives that have been affected. And literally every area of your life is affected by addiction. So, you know, whether we're bringing loved ones or concerned persons into sessions with them to do some family therapy, or helping them figure out how to live life sober and still enjoy life and have fun. That can be a really difficult thing for a lot of people, or just understanding what the cause was, what the root cause was. Why was I using substances? Because most people are using to try to cope, like I said earlier. So yeah, I mean, we see our role as being very vital in someone's recovery, at least in the beginning, but then our role switches to become more of trying to help them regain their independence and take control back of their life. And so we're just kind of there to, I guess, be that transition for them.
That's great. And I kind of heard between the two of you mention different varieties of types of help that you're able to offer. So, you know, you said family therapy, you said group therapy. I'm assuming that that really does depend on the individual. Is that kind of like, so, you know, in my mind, I sit here and I go, you have such a big role. So these individuals obviously need a support system. And so when they're coming to you, how do you know how to help them the best?
When we do our initial appointment, where we do our evaluation or assessment, we often look at all of those areas. We look at both their substance use behaviors, and maybe if they're having any significant withdrawal symptoms, or if they have in the past. We look at their physical health. We look at their emotional, behavioral health, their readiness to make changes. We look at how likely it is that they're going to continue using or relapse if they have stopped by the time they've already gotten to us. And then another big piece of it is we look at their recovery environment, is what we call it. And so who do they have for support? What are some outside entities? So when someone tells us that they are homeless, okay, we know that we need to get this person set up with supports to find housing or maybe financial assistance. You know, if they're having medical issues, we want to make sure this person is connected with a doctor if they don't have one. And if they do, trying to coordinate care with their doctors. We look at, we call it like person-centered and whole person, a holistic approach. If you just focus on the substance use and nothing else, people will not get better, at least not over the long term. And our goal is to help people heal over the long term. So by doing that assessment, and then essentially what we're doing is every time we meet with that person or talk to that person, we're reassessing what's going on in their lives today. Are there new things that have cropped up in the last, you know, couple of weeks or however long it's been since we've talked to them? Do they need different supports now? Do they need additional supports? Maybe they've accomplished an initial goal. Great. Let's talk about what your next goal is that we need to work on. So we're just constantly having those conversations with them and trying to determine. And so we need to be really connected to our community, because our community resources change frequently. Unfortunately, there are so many people that need to utilize resources that oftentimes they run out. So we kind of need to have all of that just in the back of our head, ready to go at a moment's notice, because sometimes people come to us in crisis. Especially, you know, you think about living in Iowa, we're entering very cold months, and housing is an issue for a lot of people. So.
Well, and Lindsay, you did mention, you know, quite a few challenges then that come up. So what would you say are some challenges that you face as a substance abuse counselor? Darcy?
I think some of the challenges are lack of resources in our community. Marshalltown is relatively small compared to maybe Waterloo or Des Moines or other surrounding areas. So we do not have a lot of resources. So being creative. being able to pull together with the resources and the other agencies that you have, and maybe looking outside the box to see how you can be creative. I think the other probably challenge is that so many of our clients have those co-occurring issues. They have both substance use disorders as well as mental health issues. And so, it just really kind of depends what's going on. One time they're in your office, you really could be focusing on the substance use disorder issues. And then another time it could be that they are really struggling with their depression or their anxiety. And you have to set aside any of those other things and really look at what's the pertinent issue that you have to do.
That's great. Yeah. It seems like, again, quite an important role that you guys are holding. And so what kind of characteristics or skills do you need to be successful in this type of career?
Most,
oh, go ahead. No, go ahead, Lindsay. You're fine.
I was just going to say, I mean, so first of all, education is important, and we continue with professional development. We're required to. So most substance abuse counselors, well, a bachelor's degree is required. And then what we do is we go on to receive certification with the Iowa Board of Certification. So there are a couple of different certifications one can get. I am not sure, Darcy, what yours is. You can chime in. I'm a certified alcohol and drug counselor. That was the first certification that I received prior to even getting my LMHC, my mental health license. So you get this certification basically stating that you have the education and some experience behind working with this clientele. And then every 2 years you have to recertify. And so that's a commitment that we make to stay up to date about, the latest and greatest on substances that are being used, how people are using them, because every day is different in this field. I mean, I'm sure Darcy has had some stories over the years too. You'll get a client coming in and I'll have a counselor knocking on my door asking me, so what diagnosis do I put for a client who's using this? And it'll be just this brand new thing that we've never even heard of anybody using to become impaired. And so, we're constantly trying to do professional development. We want to make sure that we're talking with our colleagues, consulting, taking care of ourselves in the process, because the job can be stressful when you work with people and people that are struggling. You inevitably care about your clients and you want to see them succeed. And unfortunately, not everyone does. At least not the first time around, and sometimes not the 7th, 8th, 9th, or 10th time around. So, we still want to always hold on to hope that people can get better and do better. And we try to instill that in our clients. And so I guess that's one of the ways that, we make ourselves, we position ourselves to be able to care for our clients and do the best that we can.
I think I would just add to, in terms of, what does a counselor or substance use counselor need? I think that you need to have empathy. You need to be able to have really good boundaries. You need to be able to have good communication skills and good written skills.
Absolutely.
Need to be able to redirect clients, and also to be able to de-escalate situations.
Those are all really good characteristics. I can see that. Obviously, you don't know what's going to be walking into your office, right? And so you definitely want to have an environment where they feel welcomed and that they feel safe, and somebody that's going to care and listen to them. So that's great. You had mentioned that, and I just want to clarify this for those students who are listening, that this is kind of an ongoing education, right? It's not a go get your degree and then you're done. It's you continue to grow. So can you talk a little bit? I know, Stacy, you had mentioned, you started with this certificate, then you went to this certificate. Is that normal? What if I just want to stay in this one area? What if I decide this area isn't really what I want at all and I want to go somewhere else? Can you kind of talk about that process?
Yeah, I guess, so if you want to start off in substance abuse treatment, you need your 4-year degree. Generally speaking, there are certain degrees that are more suitable to this work right off the bat. So social work, something that's in the counseling related field. So we have had counselors over the years that maybe had something in the human services field, and they have been able to become employed and then do further education to get their certification. But it's a lot easier and quicker all around if you start off with a 4-year degree in a counseling related field. So it kind of just depends. My experience was not that. My undergrad was actually in something completely unrelated. However, I went back to grad school before I ever started working in the field. So my situation was a little different. Once I started working here, and like I said, I had started actually working as a gambling addiction counselor, which, by the way, is very similar work. We always say addiction is addiction is addiction. So very similar, just a couple different nuances between the two. But while I was working in that program, I was also working on getting my certification and my independent license, because I knew that I wanted to work in the behavioral health field in some capacity. So my goal, I really enjoyed doing the substance abuse treatment that I did during my internship. And so my thought was that eventually I would be doing that. I was trying to kind of help out here and there, even when I was doing the gambling treatment. And then I eventually did. And so my track was maybe a little bit different. I don't want to paint the picture that you have to get your master's degree or that you have to become independently licensed. That was just the path that I took. But you have the opportunity, most treatment centers require that to become a certified alcohol and drug counselor, that CADC. And so from there, they require that you do the professional development needed to recertify and keep your certification. And so that's kind of the minimum requirements to be a substance abuse counselor. And really the purpose is just to keep you up to date, allow you to provide the very best care to your clients, and just to be, again, taking care of yourself, because some of the professional development is just, how do you cope with a high stress environment, because it can be kind of stressful sometimes. And, some of that professional development is like learning boundaries, like Darcy was saying, and things like that. So that's kind of that certification piece. There are the EMDR certification that I have, the trauma therapy, that's more for like mental health therapists. So somebody that would have a master's level degree. And so certainly a lot of treatment centers, Situsi, and you can talk specifically about that, Darcy, but they are different than Pathways. And so at Pathways, we have like a mental health program. And so a lot of our counselors and therapists are dually licensed and certified. So down in the Marshalltown area, if Darcy was working with a client for addiction issues and they had a co-occurring mental health disorder, she would be referring them to whatever the local agency, I think it is, Center Associates down there.
Yeah.
So the local agency that works with that particular. So at Pathways, I guess it's, the environment has changed a little bit. So more people are going on to get their masters and to do kind of that dual license certification. We found it to be helpful just in the sense that, some people would prefer just to tell their story to one counselor and work on both things together. That's not always the best way to go though. So that's kind of how it's worked for us. But Darcy, I don't know if there's anything that you wanted to add to that.
Yeah, no, we employ both individuals at the bachelor's level with the certification of the CADC, as well as master's level individuals.
Oh, okay. Great.
Right now I have 3 master's level clinicians on staff. And so I think one of the reasons that we've done that is, again, just to be able to better serve our clients. We have a CARF certification, which is a certification that is says you have high standard of service, basically high excellence. And so our CARF certification does allow us to provide some co-occurring issue or co-occurring counseling as well, some very basic depression, anxiety, things like that. So that come with a variety of different things. So we do that. But what I look for when I'm looking for a new clinician is to have a degree either in social work, psychology, or some type of human services related field. And they are required to get their CAD certification within 6 months of employment. And that is something that I don't know if all agencies do that, but we at Satusi feel it's important to be able to help our individuals do that. So we help them get that education. There's also some really great programs. I recently, I know I have a new employee who came from, I think, Buena Vista program. And she knew that she wanted to be a substance abuse counselor, told her, so she tailored her classes towards being a substance abuse counselor. And I believe when she got out, she only had to take one extra class. So, if those are the things that you want to do, you need to be talking to your staff there and making sure your classes are tailored to that type of work.
So you kind of both mentioned how it works in different locations. So if I am a person who wants to be a substance abuse counselor, what are my opportunities? Where all can I work?
Well, you can work in a number of different locations. We are treatment centers, so state funded, licensed, accredited treatment centers. And so there's a number of those across the state. You can, if there's hospitals that have, oftentimes they do the more intensive, well, I guess they have outpatient too. So hospitals will sometimes have programs, Mercy One, St. Luke's, University of Iowa. So some of those places. There may be some different practices that might want to hire someone that specializes in substance abuse treatment. So there's a lot of different avenues for folks. It just kind of depends on, what kind of environment they're looking to work in and maybe what level of care sometimes they want to work with.
So we talked a lot about college and what kind of degrees that are needed to pursue this type of career. What would you say are valuable high school classes that either you think students should take or that you took that was a benefit to you going into this field?
I think any psychology class you could take, sociology class. I also think if there's opportunities to take communication classes or speech classes, because oftentimes you are speaking, you're in group speaking, you may be asked to speak in public at different things like this. So you have to be very comfortable being able to speak with people and be able to articulate and communicate.
I would agree with all of that. I'm actually trying to think way back to when I was in high school and what classes I took. And again, my undergrad was in nothing related to counseling, but I find that, well, I guess I'll just tell you. So my undergrad was actually in graphic design with a minor in journalism. So just to let all of the students know that if you want to change your mind, you go ahead and do that. It's never too late. I'm proof that you can do that and still get by okay. I might have some extra student loans, but that's besides the point. But just to, I look back on that though, and I remember thinking, well, I've never really regretted it because there's always been a time where some skill that I learned from those classes or, like maybe my language arts, typing, speech classes, all of those things where they come into play in the work that I do. Because like Darcy said, you have to be able to communicate, and we communicate with a lot of people frequently, and we have to be able to do it quick and efficiently, because if we're seeing clients all day long, we're emailing and we're making phone calls and we're talking to probation officers and DHS workers and family members and attorneys. And so we have to utilize all of those skills, even in between our sessions with clients. So I think that, yeah, she hit it on the head with that.
I think the other real important thing is that you have to learn how to be an advocate. You are definitely an advocate for your clients, because we are talking to those probation officers, DHS workers, attorneys. You just are talking to so many different people, and even helping them to be a self-advocate for themselves, because there's such a stigma about substance use, people who are struggling with addiction, such a stigma still about that they need to be able to self-advocate for themselves.
That's so true. It's being able to help others learn how to help themselves, right?
Yeah.
So that's great. And I know that you mentioned, all these other things that you have to do throughout the day. So I know that the day changes depending on what it looks like, but could each of you kind of give us a rundown of what your, if it's a typical day, what does that look like?
So as a typical day as the counselor, the substance abuse counselor, you are going to pretty much be seeing clients. You'll probably see 7 to 8 clients a day, just depending. Again, you have to take into the factor that sometimes the clientele that we're working with don't always show up for their appointments because they're struggling. And so if they're not showing up, you're going to be on the phone, making a phone call to them and trying to get them to be re-engaged. You may be facilitating a group that day or that evening. A lot of paperwork. So if you don't like paperwork, this is not the field for you, because there is a lot of paperwork, a lot of documentation. You have to be able to tell their story. One of the things that I tell my clinicians is, if somebody is ill, I want to be able to go look at that chart and be able to know what is going on with that client. Because things do change very quickly. If that client is in crisis, I want to know what they've been working on. So you have to be able to have good written skills as well and do that. Phone calls, meeting with clients, meeting with family members, consulting with other clinicians. So that's kind of the typical day of the counselor. In my current role as a clinical director, I do have a very small caseload, so I do see some clients. I also, a lot of it is administration, providing supervision to my clinicians, putting out fires. I'm kind of the one, when people call in for crisis, I'm the one that usually gets that phone call. So it's just ever changing. I think that's why I like it so much. It's never a dull moment.
Yeah, I would agree with that. That's often what I tell people as well is, if you're someone that doesn't want to go to work every day and do the same thing and be bored, then this is the right profession for you. It is always different because you're working with people and everybody's different. Yeah, I think the only other thing that I would add to that is, she had mentioned, individual sessions, group therapy. Most of our clinicians facilitate more than one group. So depending on what your schedule is, you might have a couple during the day, maybe you just have one. We usually have our clinicians work one later day a week, because we provide evening groups, just so that if people are working like a first shift job, or maybe even sometimes a third shift job, they might prefer to do a later in the day group, but we do have groups during the day as well. So not a lot of evening work usually. We don't work on the weekends typically. Right now, because of the pandemic, we're doing, there's a lot of being on your toes, right? So not just clients coming in crisis, and we have open access hours that we just recently started at Pathways. So we have like these 4-hour blocks of time where a clinician is not scheduled to meet with anybody. So it's anybody that walks in that needs to be seen. So in that case, that's you have to be on your toes a little bit more, because a lot of people that are scheduled, even if it's for an evaluation, you get a little background information, at least about why they're there, and maybe if they're on probation or if they were referred by like their doctor or something like that. When people walk off the street, you know nothing about this person. You get a call that says, hey, you got a client here that needs to be seen. This is their name. And that's about the long and short of it. And so just being on your toes, flipping back and forth between telehealth like we're doing now. So because of the pandemic, we see people on the computer or see them in person. So, and sometimes that can change at the last minute. I know sometimes I'm getting clients late or getting on the computer late because they called in 5 minutes before their session and said, hey, I can't make it there. I don't have transportation. Can I see Lindsay on the computer? So just, you know, kind of always like looking at a lot of different things, but we stay very busy. And anytime that we aren't with a client, we are coordinating care or in a meeting. We try to get together for staff meetings periodically just to have that group cohesion with our team and stay up to date on all the changes, because things change a lot, especially right now during the pandemic. Things change a lot. So yeah, but you know, if you're somebody that enjoys that, a fast-paced, ever-changing environment, then you would like this work because you're never bored, ever.
Never.
That's great. And just to kind of close us off, I would love to hear what you wish you would have known or what you wish you would have done differently as you pursued this career.
Well, I can just kind of tell a little bit of background about me. I did not start out wanting to do this career. I knew I wanted to do some type of social work, but I really was not interested in working with people who had substance use disorders. So I started off working, I did some mental health stuff, and then I worked in a hospital setting. And my boss at the time, who became my boss, she's no longer my boss, but my boss at that time kept saying, I think you need to come work for me. I think you need to come work for me. I'm like, no, I really don't think so. I don't want to sit all day, listen to people's problems. I really don't want to hear people talk about their substance use problems. I don't know what clicked, but one day I said, all right, fine, I will come work for you. And I think what I would have liked to have known before working here is just really having a better understanding about what substance use disorders are, what addictions are, not having that preconceived idea that people who have addictions, they're just not going to get better, because they do. I came from a hospital setting where in the ER, they didn't really enjoy working with people who struggled with mental health or substance abuse issues. And that's really sad now that I'm 17 and a half years into this, is that these are just people like any other person. They are just struggling. People who struggle with addiction are not bad people. Actually, they're some of the most amazing people that I've ever met. I think it's just really important that you have to keep an open mind. There's going to be things that are going to shock you when you have a pregnant woman sitting in front of you who's shooting IV meth, shooting up heroin, and you're thinking, wow, how can you do that when you're pregnant? She does, and you just need to know that's not what she wants. It's not what she wants for herself. It's just, drugs are just so powerful. So I just think, it's just some of those things I wish somebody would prepared me for, but at the same time, you just learn, you just kind of go. I don't think anybody could fully prepare you for all of the different scenarios that you're going to encounter. But just knowing the importance of having an open mind, knowing that people are good people. People make mistakes, but that doesn't mean that they can't get better. And also not to think that just their first time around, they're going to get better. It's a marathon. It's not a race. Recovery is not a race. It's a marathon, and it takes time. And each time a person enters treatment, they gain a whole bunch of tools, they put them in their toolbox. They may not use them right away, and that's okay. But each time they're taking out a few of their tools, where, our goal is eventually that our hope is that one day they'll use all those tools and they'll be able to maintain their recovery.
I don't know that I really have anything that I wish I would have done differently. I'm a big believer that things happen for a reason, and I love where I'm at. And so in that respect, I would say kind of also like what Darcy was saying is just it's not anything that I don't think anybody could have really prepared me for, but you learn with experience and with working with people. I think right out of college, being a new counselor, you have this sense that you just want to help everybody and you want to save everybody and you don't want people to hurt, and it hurts you to see people hurt. And I think one of the hardest lessons that I've learned over the years is just that we can't save everybody. That sometimes people come in and they're not ready to get better. Because initially that was hard to understand that and to think like, well, what am I not doing right as a counselor? And to realize it's maybe not necessarily anything that I'm doing, but also too, like I'm always just trying to think about how could I be a better counselor. But yeah, I mean, I guess I don't have a lot more to add to that question necessarily.
No, I think that's great for both of you. So again, I want to thank both of you for being with us today and for shedding some light on this career path and what the expectations are and what the goals are and what great characteristics there are to be a great counselor. So with that, I'm going to say thank you and we're going to end the session. We will have a slide that's going to show a little bit more about following steps if this is something that you are interested in pursuing. And I want to thank you for all joining us today.
Thank you for having us.
Thank you.